Hello, everyone. My name is McKenna Peters, and today I will be discussing the supplement glucosamine. So what is glucosamine? Glucosamine is a supplement that is harvested from shells of shellfish or made in the lab. There are several forms of glucosamine. Three of them are glucosamine sulfate, glucosamine hydrochloride, and N-acetylglucosamine. Glucosamine is used to orally treat a painful condition caused by the inflammation, breakdown, and eventual loss of cartilage, which the medical term would be osteoarthritis. So its uses and effectiveness, taking glucosamine sulfate by mouth for at least 4 weeks can provide some pain relief and improve function for people with knee osteoarthritis. Products that contain glucosamine hydrochloride do not seem to work as well unless they are taken in combination with other ingredients. So its dosage and side effects, glucosamine sulfate can be taken by mouth. It's likely safe in most adults when used up for 3 years. And glucosamine hydrochloride is safe for most adults when used up to 2 years. And both have most often been used by adults in dosage of 1,500 milligrams by mouth daily for up to 3 years. So for N-acetylglucosamine, it's possibly safe when used for up to 6 months. And then when applied to the skin, like as a topical ointment or cream, it's possibly safe when used for up to 10 weeks. And when given as an enema, it is possibly safe when used in doses of 3 to 4 grams daily. So here I provided you guys with a diagram of osteoarthritis in the knee. You can tell that the cartilage is beginning to break down, and which causes the inflammation and the pain in the knee, and hence the reason why the supplement glucosamine can help prevent or help relieve some of that pain in the knee joint. So for my first study, it was the efficiency and safety of glucosamine sulfate versus ibuprofen in patients with knee osteoarthritis. In this study, 178 Chinese patients suffering from osteoarthritis of the knee were randomized into 2 groups. Group 1 was treated with glucosamine sulfate with a daily dose of 1,500 milligrams, and Group 2 was treated with ibuprofen with a daily dose of 1,200 milligrams. So the knee pain at rest, at movement, and at pressure were recorded after the 2 and 4 week of treatment, and the variables were recorded also after 2 weeks of treatment discontinuation in order to appreciate the remnant therapeutic effect. Both the glucosamine sulfate and ibuprofen groups significantly reduced the symptoms of osteoarthritis, with glucosamine sulfate being slightly more effective. The adverse drug reactions, 6% in the patients of the glucosamine sulfate group, as in 16% of the ibuprofen group, and the drug-related dropouts was 0% of the patients in the glucosamine sulfate group compared to 10% in the ibuprofen group. So it was confirmed that the glucosamine sulfate group was the selective drug for treating osteoarthritis. For the second study, it was a randomized double-blind placebo-controlled trial of a topical cream containing glucosamine sulfate, chondroitin sulfate, and camphor for osteoarthritis of the knee. 63 patients were randomly assigned in this study to receive a topical glucosamine and chondroitin preparation or a placebo to be used as required over an 8-week period. And the primary measure was the participant pain rating based on a 100 millimeter VAS scale. So it was assessed in the clinic at 0, 4, and 8 weeks. So here I provided you guys with the table showing some of the results, and this table provides a summary of the data with the changes over the 3 clinic visits. So between 5 and 9 tubes containing 114 grams of cream were given to participants. In the active group, participants used a mean of 5.5 tubes with a mean usage of 2.4 times per day. And in the placebo group, the participants used a mean of 5.7 tubes with a mean of 2.7. Between the baseline in weeks 4 and 8, the subjects in the placebo group improved on average in the VAS pain. And then in similar improvements, although of greater magnitude, were seen in the advanced treatment group. So on this next slide, I have I guess table 3 is right below it. I think I have it on both slides. Yeah. So table 3, the differences in the improvements between the placebo and the active treatment groups were given. The VAS scores indicated a greater mean reduction in pain for the glucosamine chondroitin preparation group compared to the placebo group at both 4 and 8 weeks. After 4 weeks, the difference between active and placebo groups in their mean reduction from the baseline was 1.2, and this difference increased to 1.8 after 8 weeks. So, like I said, the VAS scores indicated a greater mean reduction in pain for the glucosamine chondroitin preparation group, and it was proven that the topical application of glucosamine and chondroitin sulfate is effective in relieving the pain from osteoarthritis of the knee improvement, and it was evident within the first 4 weeks. So to summarize, glucosamine appears to be safe, and it might be a helpful option for people who can't take a non-steroidal anti-inflammatory drug. The oral use of glucosamine sulfate can cause some side effects like any other supplement. It can cause diarrhea, heartburn, nausea, constipation, and also be aware, because glucosamine products might be derived from shells of shellfish, there is a possible concern that the supplement could cause an allergic reaction to people with shellfish allergies. But people do use glucosamine sulfate to orally treat a painful condition caused by inflammation, breakdown, and eventual loss of cartilage. Here are my references, and I hope you guys learned something today. Thank you.